I am Dr. K Ganju, hematologist at Nagpur. Thalassemia is present in Mediterranean countries, South Africa, India, Pakistan, southeastern countries. To prevent this disease, we need to see all pregnant women at 11th week of their gestation. We must investigate and find out if they are thalassemia minor. If they are found to be thalassemia minor, then their husband should be tested for thalassemia minor. In case the husband is also thalassemia minor, then there is 25% possibility of the fetus having thalassemia major, and therefore accordingly we can take further course of action. We can do prenatal testing in this fetus at the age of 12 weeks. So if they are found thalassemia major, one can do NTP. If they are thalassemia minor or others, they can all be safely delivered. So I think this is very important for getting the test done for all females who are going to be pregnant to know that they are thalassemia minor. Or this can also be done during the early weeks of pregnancy to prevent the birth of a new thalassemia major. Thalassemia manifests as thalassemia minor, which is a carrier state, and thalassemia major, which is a disease state. Usually, the manifestation occurs between the 6 months to 1 year of age, and patient comes with severe anemia, and we subject these patients for hemogram or CBC by the cell counter, and what we see is low hemoglobin, low MCB, low MCH, and a high RDW. And also the cell counters will pick up the normoblasts. If you see the peripheral smear shows you gross amelocytosis, shift cell, that means you can see the myelocytes, metamyelocytes, and a predominantly normoblasts in the peripheral smear. And that all suggests that this is hemolytic anemia, and the morphology goes more in favor of thalassemia major. The most modern cell counters, they can differentiate iron deficiency anemia from thalassemia minor. In thalassemia minor, we have low hemoglobin, low MCB, low MCH, and a normal RDW, as opposed to in iron deficiency anemia, though we have low MCB, low MCH, but the RDW is high. If you see the red cell count is much higher in iron deficiency anemia than in thalassemia minor. The newer versions of cell counters which do the testing by the flow cytometric technique, they can pick up the reticulocyte hemoglobin. The reticulocyte hemoglobin is very low in iron deficiency anemia, whereas reticulocyte hemoglobin is towards the lower side in the normal range in thalassemia minor. So the reticulocyte hemoglobin can also help us in making a diagnosis of thalassemia minor.